you. I too start by acknowledging the traditional owners of the land on which we meet, the Wurundjeri people of the Kulin Nation, and in a spirit of reconciliation, pay my respects to elders past and present. I'm going to thank Catherine for that world-class and very generous introduction. Thank you for that. I'd like to acknowledge Georgie, the CEO of Beyond Blue, who's here today, and many members of the Beyond Blue team. And friends and supporters beyond. I think we are expecting Michael Kidd, one of our directors, to join us as well. I would also like to acknowledge the millions of Australians who live with or support someone with a mental health issue. In acknowledging you, each of us pledges to work to prevent mental health conditions, half of which emerge before the age of 14, and to help everyone in Australia achieve their best possible mental health. While supporting each other to improve mental health is important every day, we're here now because today is extra special. Today we are launching the Centre of Research Excellence in Childhood Adversity and Mental Health, which, as you've heard, is jointly funded by Beyond Blue and the National Health and Medical Research Council. Beyond Blue is proud to be supporting the amazing team at the Murdoch Children's Research Institute, who are dedicated to discovering ways to prevent and treat conditions affecting babies, children and adolescents to enable them to lead happy, healthy lives. The Institute was launched 33 years ago with the support of the remarkable and much loved Dame Elizabeth Murdoch. Beyond Blue, of course, is the brainchild of Jeff Kennett, the former Premier of Victoria and my predecessor in the role of Chair. Now we are uniting to advance the work begun by these two extraordinary Melburnians. We know that childhood experiences shape the adults we become, and that mental health in the foundation years can affect the course of the rest of our lives. In many cases, children who have good mental health and the resilience to bounce back from early adversity can carry it with them through their adulthood to the generations that follow. But those exposed to ongoing disadvantage or trauma in the early years are not so lucky. Sadly, for thousands of children, poverty, neglect, abuse, bullying, family conflict or violence, inadequate housing or homelessness, other family members who experience poor mental health or physical health or drug and alcohol problems are part of everyday life and profoundly affect their futures. The term adverse childhood experiences encompasses all these types of abuse, neglect, and other potentially traumatic experiences that occur to people under the age of 18. The harm of these experiences can show immediately. In fact, around 1 in 7 children aged between 4 and 17 will experience a mental health condition in a year, equating to 560,000. Many dealing with the burden of this mental ill health will have suffered adverse experiences. The impact can further cascade into poor learning outcomes. For example, children with persistent emotional or behavioural problems fall a year behind their peers in numeracy in the 4 years between years 3 and 7, with similar, although smaller, trends in reading. The harm of these adverse experiences can have long-term implications, significantly increasing the likelihood of children developing mental health conditions that have lifelong social, academic and employment implications. In fact, up to 1/3 of depression, anxiety and self-harm conditions experienced by Australian adults are related to childhood maltreatment. In recent years, we've learned much about the impact of childhood trauma. As you know, the government I led initiated the Royal Commission into Institutional Responses to Child Sexual Abuse, which handed down its findings at the end of 2017. I've been humbled by the great courage displayed by people who gave evidence to the Royal Commission and who shared harrowing stories of the impact of those childhood experiences on their lives. What those stories tell us is that it is not good enough to be a sympathetic bystander, a silent witness to abuse, inequity and disadvantage. We must continue to remind those who have experienced childhood adversity that their voices have to be heard, that they are believed. And we must continue to prevent future failings so that generations to come are not trapped in the same cycle of trauma and disadvantage. Preventing the circumstances that contribute to mental health issues in young people or mitigating their impact must continue to be a national priority and target of ongoing investment. And when prevention is not possible, early intervention is essential. Getting better at both requires new research and new ways of working. We believe in that profoundly at Beyond Blue. Indeed, since 2000, Beyond Blue has invested nearly $70 million in depression, anxiety and suicide prevention research. Now Beyond Blue is honoured to partner with the National Health and Medical Research Council in funding the $2.5 million Centre of Research Excellence in Childhood Adversity and Mental Health. The centre will be led by Professor Harriet Hiscock from the Royal Children's Hospital and MCRI, and involves researchers from across Australia, including Monash University, the University of Melbourne and the University of New South Wales. This 5-year initiative will draw on the experience of researchers and practitioners from paediatrics, education, psychology, psychiatry, population health and health services. It will investigate which adverse childhood experiences and the developmental stages at which they occur are most associated with depression, anxiety and suicidality. It will research which interventions are most likely to be effective in reducing the impact of these traumas. Today, together, we take a stride forward in breaking the cycle of childhood adversity and mental ill health. It's my pleasure to officially launch the Centre of Research Excellence in Childhood Adversity and Mental Health. It's great to be with you. Thank you very much.